As I listen to the news, I hear the number of cases is going up off of a lower base, albeit, and even the number of hospitalizations is going up. What's happening?
Well, what you're seeing is this variant, which we refer to as the Delta variant, is now becoming more and more dominant in the country. It's close to 60% overall in the country, and in certain regions of the country, it's over 70%. The issue with the variant is that it has a much greater capability of spreading from person to person. There's no question about that. So if you have this virus circulating, it's much more likely to spread efficiently. And that's what we are seeing, particularly among unvaccinated individuals. Vaccinated people are generally protected from infection, not completely, because remember, the vaccine trials that showed the efficacy of the vaccines were based on the ability to prevent clinically apparent disease. The one thing this vaccine still does very well with this variant, it protects you against severe disease that might lead to hospitalization and death. So what we're seeing now in this country is a significant uptick in infections, particularly in those areas of the country, those states, cities, regions, counties that have a very low level of vaccination. Whereas in contrast, in those areas with a higher level of vaccination, we're seeing less of an uptick. But among unvaccinated people, that's a significant risk. And that's the reason why we are practically pleading with people to please, if you're not vaccinated yet, seriously consider getting vaccinated, because this is a nasty virus, particularly if you're unvaccinated.
So I just want to be very precise here, because it's a confusion I've had as I've listened to the news. It was said by administration officials, this is a pandemic of the unvaccinated. It's not quite right? Because you can get the disease, you can get the virus, even if you're vaccinated. But the point is, it's a hospitalization and a critical illness of the unvaccinated. Is that right?
Yeah, that is true. But let me just, with one fine tuning of it a bit, if I might, is that the vaccine still protects you against infection, but not completely, not nearly as well as it protects you against clinically apparent disease. So if you compare the vaccinated with the unvaccinated, just getting infected with no symptoms, you're much better off being vaccinated than non-vaccinated. The real difference is seen when you are vaccinated, if you do get infected, versus if you're unvaccinated and get infected. You are very highly protected against severe disease if you're vaccinated, whereas if you're unvaccinated, then you have a reasonable chance of getting into trouble.
So Doctor, you're an acclaimed public health official. I wonder if part of public health is information. And by that, I mean, what about the misinformation that's being spread around? We heard, actually, the White House come out and really say Facebook is making things work, maybe even killing people because of some of the misinformation that's available in social media. As a public health official, what can you do about misinformation? How big a threat does that pose to the United States right now?
Well, it certainly is a threat. And the Surgeon General himself made this very clear on some of the Sunday shows just yesterday. The best way to counter misinformation and disinformation is by providing a lot of correct information. And that's the reason why you have to get trusted messengers out there. The people who people in the community look to and trust. That could be a family physician or a healthcare provider. A clergy person is another group of individuals that are highly respected, or community leaders that people in the community look up to. Much better than having government officials always doing it. So that's the reason why we continue to encourage the communicators, namely the people who are trusted communicators and trusted members of the community, to go out and try and essentially eliminate, if possible, this misinformation and disinformation, which in fact does cause lives. Because if disinformation about vaccinations allows people who otherwise would have gotten vaccinated, essentially leans them towards not getting vaccinated, that's really terrible because that's putting people's lives at risk.
So, Dr. Fauci, I'm getting some communications from viewers right now who are really asking if we can be more precise, have numbers to put some of these things in. Let me give you the example that's being given. Is there a way, and I don't want to push to precision that doesn't exist, but is there a way of saying your odds of getting this disease are X if you're unvaccinated and Y if you're vaccinated? Because sometimes that kind of precision might actually change some people's minds.
Yeah. Well, the only precision you can do is to compare in the clinical trial data and what is in the real world efficacy and effectiveness of the vaccine. So if you are vaccinated, you have a 93 to 94% protection compared to the people who are not vaccinated. That means you have like a 9 out of 10 chance of not getting infected compared to the people who are unvaccinated, who have absolutely no protection except some natural immunity, which may or may not protect them. So what you got to look at, importantly, is the protection against clinically apparent disease, which is less precise, is the protection against any infection, even if you don't get any symptoms at all. Because the clinical trial, the endpoint of the clinical trial was protection, which was 93 to 94%. Against clinically apparent disease. Namely, you feel sick, you feel a little chilly, you get some aches, things like that. How well you are protected against any infection, even the infection which doesn't give you any symptoms, is clearly less than the 93, 94%. And depending upon how you monitor it with testing with blood tests, it's somewhere between 60 and 80% or so. But that's an imprecise number. And that's the reason why you don't talk about it that much, because the data for that number are much less precise than the very precise data that you are 93 to 94% effective against clinically apparent disease.
So, Dr. Fauci, let's talk about how this might change our lives. And we understand we don't know exactly how this is going to unfold, but given where we are right now, given where we're headed, what is the likelihood we may have to go back to wearing masks indoors, even those of us who are vaccinated, by the fall? And similarly, is school at risk? Going back to in-person school, is it at risk, do you think, come fall?
You know, the answer is everything is on the table. I mean, I don't want to be saying this is a risk or not. Then it becomes a soundbite that's taken out of context. I think what we're seeing now is enough of a dynamics of the outbreak that you've got to do the best you can to contain it. The best way to do that by far is to get vaccinated. Now, you're starting to see in cities like Los Angeles, recently the American Academy of Pediatrics has said when children go back to school, given the dynamics of the outbreak with the Delta variant, they're recommending that children, whether you're vaccinated or not, wear masks. The CDC is not there yet. The CDC still says that if you are fully vaccinated, you do not have to wear a mask indoors or outdoors. But with that as a background, there are local enterprises that are saying, you know, given the uncertainty of the number of people that are vaccinated in the community, given the fact that there's an uptick in infections that we are clearly seeing with this Delta variant, many are recommending that even though you are fully vaccinated, when you are indoors in a community with a high level of infection, in an area that does not have a high percentage of vaccines, you may want to consider wearing a mask even if you're vaccinated. And even though that isn't the precise definition that is get from the CDC does provide a degree of flexibility that if you are in a situation, even if you're vaccinated, you have the discretion of going the extra mile of protection by wearing a mask. And I think you're going to see the same sort of recommendations as we get into the school year. The American Academy of Pediatrics has already gone there. What we want to see is what happens as we get into August, the end of August, the beginning of September, when the school year starts, to see where we are in the outbreak. And then you'll be hearing recommendations from the CDC whether or not they would change any from what they are right now.